hold on, don't give up. I know there was somebody who was like, I'm ready to just give up. Don't give up. It's going to get better and you can still make an amazing difference in people's lives, which is partly why I invited Erin to come talk to us. She mentioned something, I don't even know where it came. I was in Facebook group and she had this great comeback for somebody and I went, oh, I got to talk to Erin. So Erin and I met online. We had a little one-to-one and it was like, all right, this is a woman after my own heart. And I think many of you, I think 99% of us are doing this to help people. You never knew you could help people so much by selling insurance, right? You grew up thinking, those salespeople, insurance, it sounds boring. Or maybe it's a life insurance person and they tell you how much money they make and you're like, oh, I can do that. And it's a totally different ball game. Most of us got into this and then we're finding out how much we can help people every day. Joshua's got, he holds the record for telling somebody that how much their insurance will cost. And like, what'd you say? It was 2 hours later, they called you and said, I retired, I quit, sign me up, you know? I love that. I love that we can help people get out of a job they hate, right? So Erin, I have a question, I guess, is how long have you been an insurance agent?
So I've been doing insurance. I started with Colonial Life 2018. So what are we, 6 years in now? And then started kind of branching out with a partner, the person who recruited me. So started doing life and health. And then I've been doing ACA for, I think this is year 3 now. And then that's kind of it. So I do supplemental. I do Medicare. We started Medicare this past couple years. I do ACA, several supplemental benefits. And then I also do some work as a community health worker, which is kind of where we started talking about how you can help people that we think that we can't help. So, yes.
So see, she's like last week's guest started with more group stuff on the ancillary Colonial Life. Last week started with Aflac, and then it kind of grew into the individual world. And then I guess I wanted to know is when you started, whether it was with Colonial or even ACA, what was it that made you stay with it? What is there like a moment that you're like, oh my goodness, I'm doing this. This is my career now.
Yes. So I was recruited by actually my best friend. So I had just gotten done with the second round of school and was trying to figure out what to do. Thought I wanted to teach. And she said, nope, I got us a job. We're going to do insurance. And I'm like, we're not, but okay. And so here we are. So when we started doing Colonial, there was a minute that I thought I was going to quit doing insurance. And it was because I started seeing some bad parts of insurance, agents taking advantage of people that as I kind of saw that happening, I mean, just things like signing up a family on an accident plan with a supplemental insurance that had Medicaid, that we knew that they weren't going to be paid out from Medicaid. That money is going to go straight to it, but you get higher commission if you write a higher plan. So when I started talking to those people and saying, hey, you really shouldn't be paying for this, let's change it. It kind of turned into, well, what can I do? It was kind of a challenge, to be honest, when I'd start and look at somebody's insurance and enrollment and saying, what do you need? What is your actual Blue Cross Blue Shield or whatever insurance, and how can I help you? So it kind of went like that. And then I was going to leave Colonial Life and get out completely, but decided that I was going to just start talking to some more brokers and people who are helping. And so, yeah, but the moment I decided, yes, I was going to do it was when I had a family that was able to go from paying, I want to say $900 out of their pocket, about what I pay for my family insurance, to they pay zero now. And it was all things that was information I had as an insurance agent that was able to do that for them. So that was the moment.
That's right. Wow, I can help people. So that's excellent. So go ahead and introduce yourself, particularly how you got into what you're about to show us.
Okay, so I'm Erin Owens. I live in Clanton, Alabama right now. So I'm right smack in the middle of the South, right smack in the middle of the state, right smack in the middle of, we don't have Medicaid expansion in Alabama. So we are one of the 10 states that do not. We have a huge gap in coverage. So we have a lot of people that are not under the age of 65, or not over the age of 65, not under 19, not pregnant, or don't fit those few requirements. They can being medically needy in Alabama to hit Medicaid. So how I got started in this is I volunteered from a young age, starting with like the American Red Cross. I was in the healthcare field for a while, worked at a University Hospital. So we dealt with charity care a lot. And then as I started getting older, and especially when started doing insurance, I started realizing that, how a lot of that program worked. I did some work with the Hispanic community here. I speak Spanish, so I did a medical interpreting program at Stanford University in Birmingham in 2008. So that, all those kind of things led up to where I am now. And so now that we are our own brokerage and have our own thing going on, I'm doing ACA. So the way that I got started, the way that we started talking is I've started, kind of looking in groups, talking about with other brokers and about what they're doing, how they're helping people with their ACA, and if they're not eligible for it. And so that's kind of how I've gotten started. And in the community, I went to Troy University, was given a grant for $3 million to the American government, from the federal government last year, to start and design a community health worker training program. So I was one of the big needs in my community happens to be, because we are a non-Medicaid expansion state and people are not covered, we have needs for people who need medical care that don't have insurance. And there's a ton of them out there. I don't know what the numbers are here in Alabama, but it's a lot, a whole lot that are not insured in general.
Yep. So you brought it up, so I wanted to mention it. Have you mentioned the code? We've seen it all, and I keep telling people on the Facebook, this person doesn't qualify. They don't get Medicaid. I mean, if you're on the federal exchange, there's still states that did not bring up their Medicaid. Florida's one of them, Texas one of them. Wisconsin isn't quite expanded, but we've always had pretty decent Medicaid. Alabama's one of them. I got a 23-year-old who only makes $12,000 and they're not on Medicaid. Sorry, they can't go on the marketplace. They should pay the full cost. And we'll say they could make $15,000, put them in the marketplace at $15,000, and then everybody starts fighting. No, you can't do that. Ah!
Yes. So I know everybody has their own way of doing things, and I get it. And I am never a proponent. We do not lie to the federal marketplace, period. We do not commit fraud. We do not do any of that. However, when you're helping someone apply on the federal marketplace, you are looking at a projection of their income for the next year. So that means that they have not made that money yet. And they are intending to make a certain amount. If they are projecting that amount, they're working a part-time job and they are just going by what they work now, and it comes into $12,000 a year. And like you said, they're a student, they're not being claimed by their parents. They make over $4,000. Their parents can't claim them. And they have a $3,000 gap in between the federal poverty level minimum to be eligible for ACA and what they actually make. They can intend to work those hours. We do not know, looking at them, at that moment on January 1st, whenever they apply, if they are going to end up with a $12,000 income or if they're going to end up with a $15,000 income that hits that minimum income. So I do not, obviously we don't commit fraud. We don't do that. If they have something that is close, though, there is not a penalty for making less than you projected that you were going to for the federal marketplace. So it actually says, and it's been clarified recently on 2022, I guess 122, 21 or 22. It's clarified in the Affordable Care Act that it says that if someone is found to be an applicable taxpayer and eligible at the time of application to the federal marketplace, and they're found eligible based on the income that we estimated there, that there is not a penalty for not reaching that income. In fact, it's only assessed at that time. There's not, they don't reconcile that if you're making less than 15,000, it doesn't reconcile that when they file their taxes. They're not even going to ask. The problem with not doing it and just getting it back as a tax credit is that if you have somebody who is making 12,000, you put them in the federal marketplace, and you make them pay full price for it, say it's $400 a month. If you put them in there and if you don't fit those qualifications and you don't give them those cost sharing reductions at the very beginning, so that 94% cost sharing that can, cause them to have either a $0 or $450 deductible, just depending on what plan and what state you're in. If you don't do it at the time when they, at application to get them enrolled, they can't ask for that back. So is at the end of the year, if they come in and they're saying they only made 12,000, they didn't enroll and apply for tax credits, and then you put them in at a full price and they pay it. Well, at the end, yeah, they can get that 400 something dollars or whatever back at a tax credit. But if they've had care during the year and they paid a $4,700 deductible and 80 whatever $700 out of pocket, they can't get that back. Well, there is not, like we have said a million times, there's not a penalty for not making that minimum amount. So that, like I said, a lot of people start fighting about it back and forth, and don't enter something that's not correct. And we are not doing that. But we do tell them, ask them, do you have any other source of income? Is it possible? Is your income variable? So yes, I will argue with somebody every time over that, because it's the right thing to do to get them put in a plan, if they are going to be able to even possibly, as long as they are not, it says in the law, if they are not recklessly disregarding the truth of their income. If somebody has $400 income for the year and you tell them you're going to put them at 15,000, now that's complete fraud, and we would not do that. That's a different story. So yes,
Is it
agreed,
possible?
Mr.
I mean, none of us know 100% what we're going to make. I don't care if somebody's had the same job for 20 years and they have the exact same pay income, they could lose their job. None of us know. It's a projection. So yes, you're not going to come in with somebody who's like, I am never working and I make 400. Well, then they should probably go on Medicaid. And just the two things to remember as agents, why the Affordable Care Act was created: to give people access to affordable health care. That was the whole purpose. So you're actually fulfilling the purpose. And the second thing to just remember is, and this was kind of during the whole COVID thing and all that stuff, they wanted to put in there, because they were realizing, the CMS and the feds were realizing there was this gap from states like Florida, states like Alabama, Texas, these ones that did not have a good Medicaid program, and people who didn't qualify for Medicaid but didn't make enough. They actually put that in what they wanted to change, saying that if you were in such a state as that, where you don't qualify for Medicaid and you're just going to get on the marketplace. Unfortunately, that was one of the ones that got cut, but it is their intention. I think it's going to end up back on there. So don't be afraid. What is the best for the client? The best thing for the client is that they have insurance and they have a low out of pocket, and then they will go to the doctor, because an insurance, even if they pay the 400, they're probably not going to go, because they're like, this is so expensive. So what's best for the client? And as long as, is it possible that you could make more? Sure. Of course it's possible. They might work a little extra overtime, a college student working overtime in the summer. So don't be afraid of that, and think what's best for the client. So now tell us about the different services and resources.
Okay, so different services and resources that I specifically in my community help out with. So one of them is for someone. So like we talked about somebody who, okay, so they do make $400 a year. There's no way they're eligible for ACA. There's no way that they're eligible for Medicaid in a non-expansion state. Those people have got to have care too. They need access to medical care. So the things that I do is, when somebody comes to me like that, then I say, okay, well, what are your needs? And then we'll see what we can do from there. So the first thing that we'll look at, obviously, is Affordable Care Act and Medicaid. If one of those is not eligible, we have what we call, they are federally qualified health centers that are all over the United States, that are required, run by the federal government. They run on subsidies. These are the places that are sliding scale clinics, you will hear them called. And that's how people who are not insured are getting care. So one of the first points of contact, normally when somebody comes to the point that they need something done, and they don't have the insurance, and they have a medical emergency, they go to the emergency room, or they seek through a hospital somehow, or through one of these federally qualified health. So if they have a medically necessary condition or need a medically necessary service done, there are certain programs that are available based on your income and where you live to help you with that. And they are actually all linked to the Affordable Care Act too. So people think that Affordable Care Act is just the tax credit and just insurance. It's not. There's a lot more to it. One of the things that is in the Affordable Care Act is that any hospital that is accepting, so Medicare, Medicaid, that are a nonprofit hospital, right? So that's the key, is nonprofit. And I think like 57 or 58% of the hospitals in America are nonprofit now. So if they are nonprofit and they are 501c3, that means they're not paying federal taxes, and most likely not state nor local. So in exchange for that, what the United States government requires is that they provide certain community benefits where they're located. So So what those community benefits consist of depends on what kind of hospital it is, where it is, if it's urban, if it's rural, just depending. The common thing with almost all of those is that they get their funding, where they get their funding, and that they are nonprofit. So if somebody comes to an emergency room and say they need a gallbladder surgery, they're having an emergency, and they don't have any insurance. Well, what happens from there is, because the federal government requires these hospitals and centers to provide community benefits to people within a certain range of income, then that patient can apply for what's called a patient assistance financial assistance program. And so what that is it is based on whether they make 100% of the poverty level, 200%, all the way up. It's basically, it's kind of like a sliding scale, but I think the easiest way to show somebody how to do it is, or where to look, is to do the screen sharing thing, Miss Christina. I'm going to try this. And I just want to use as example, like my hospital, because so just to give you an example, this is the website for Ascension. This is St. Vincent's Chilton Ascension Hospital that's here in Clanton, Alabama, where I'm located. So if you go to their regular website, you just go to their basic homepage. Normally, if you'll click under something that says something about bill pay, you click on whichever, like this one has several different locations. I can click on St. Vincent's Chilton, which is ours. So if a patient has been there or is planning to have a service done there, it will bring up their financial assistance page. So you'll see on here, there's their financial assistance policy that's laid out. They have their application for it. They have their billing policy, and then there's a summary of their assistance program. And then there's a list of providers that are covered by the financial assistance policy at that hospital. And as you go, you can scroll down just to get basic information and to see who's eligible for it. So on this one, you can actually make up to 250% of the federal poverty level and have 100% of your bill, of the portion of the charges for which you are responsible, written off. So what that means is that there are certain parameters and certain requirements for a financial assistance policy that you have to meet. So number one, you have to be a U.S. citizen. Number two, you have to live in, most of them, you have to live in a certain area. Like for St. Vincent's, you have to live within our county or one of the surrounding counties. Or if you are not living in the county where you're seeking assistance, where you're seeking services, then it has to be a hospital or somewhere that provides a service that's not available local to you. So once you go in there, you can look at their assistance policy. Then one of the other things that people don't realize about these, not only are they required to offer them in lieu of paying taxes, they can actually be utilized by people not just that are uninsured, but by someone who is underinsured. And what that means is you can actually have insurance, you can have commercial insurance, and if your bill, the portion of your bill that you're responsible for after your insurance is paid, if you make less, I mean, if that is more than 5% of your annual income, then you're responsible only for a certain portion of it, and it will pay to where it will pay everything in excess of 5% of your income. So if your deductible is $5,700 and that's the part that you're responsible for, and that's more than 5% of your income, it is entirely possible to have your deductible actually written off and paid for by the hospital. So most people don't realize that, and they think that there's not any help out there for them, so they don't go to the doctor and don't go to the hospital to have services done. But the key to getting the services done and the key to getting help with it is, if you think that you're not, I mean, if you think that you may be eligible for it, or if you have a client that may be, if you will call the hospital or go out there and you ask to talk to their patient assistance officers or patient financial offices, is where you can get help applying for those. At the same place that I showed you, there's an application you can fill out.
So I went on to ours because I'm in Wisconsin, right? You might be like, well, I'm not in Alabama. So here is the Wisconsin one. I went on bill pay. because I'm like, all
Yes.
right, I'll check that. Now it just showed me a bill, and I'm like, well, that's kind of. So then I went down here, patient rev, billing policy. So you can hit on the policy, and then it talks
Yes.
about it, financial, that this health system is going to try and verify how, your stuff. I went to patient rev, which revenue, I'm not sure what it stands for. This is where this system uses, and then they've got a whole bunch of solutions and talk. So you might have to search a little bit on your portal, on your website, for your local carrier, but go ahead and, take a look it over, see what you can find, because it might be a little bit harder, but when you find it, now you can just bookmark it and share it with your clients.
Right. So the other thing, so the great thing about that is as an agent and you're helping with, so if you're saying you're sitting with one of your clients and you're needing to help them and you may not have the time to sit down and actually go through that with them, it's okay. So because there is a website that is called, it's patientadvocate.org. And I'm going to share that one real quick. So patientadvocate.org not only will list a whole bunch of, let's see, share. So patientadvocate.org will not only connect you with services, you can explore all the resources or information about patient financial assistance programs. There are links to different sites for help. One of them is Patient Advocate Foundation. And there's copay relief on here that helps with medications. But the best part is that if you'll look up here, there is a number that's 1-800-532-5274. If you will call this number, or have your client call that number. So what they will do is they will get you set up with a patient advocate, and a patient advocate, so that's going to be someone who is going to help with case management for you. So if you just have your client actually call this number, then they will actually search their database and they will search for the programs for your patient, for your client or whoever needs the help, and they will help connect them directly. And then they will actually help make those connections or appointments or whatever you need, and act as a management center to assist you in getting started with this process. But for agents, it's great because you don't have to know what you're doing really to be able to help somebody. You don't have to know to be able to go to do that. I simply choose to volunteer in my community and help people fill them out and go through the process. But if you will just go to patientadvocate.org and have them connect, call this phone number. There's a button that says connect with case management. Then once you pass them off to them, they will actually do everything that I do on my part, but they will do it on their end with your client. So, and the best part is that they will pass that client back to you. If something happens and, they go through and they're like, oh no, actually it turns out you are eligible for Affordable Care Act, they're going to send that patient back to you. So, yep. And then you go ahead and write an ACA plan, whatever you need to do, or if they become eligible. So,
a couple questions that I'm just going to read out loud for our people that listen by verbal. It said, is this something the hospital caseworkers would know? I work with 3 local hospitals and their dedicated insurance agent. So yes, the hospital caseworkers are going to have that.
Yes. The hospital, the caseworkers are absolutely they are going to help. So they'll work with case management, works with the financial office. Yes, that's actually what they're there for. But there's a lot of people that leave the hospital not knowing about the programs, because even though it's required for them to hand you a paper that says, hey, this program's here, it's available, most people just don't know about it. I don't know if it's just not touched on discharge or if we're busy at the hospitals. I know that we were busy when I worked in a hospital and things kind of get handed out, but I think a
And
lot of times
sometimes you're getting so much
they
paperwork
don't
on what you're leaving, right? The care for
right.
aftercare. So you
It's
just think
lost
it's
in there.
so this is
Yes, but yeah, the problem is that you only have 360 days. So 360 days after you were billed for that service to apply for help. You can't go back 2 and 3 years and go back. And it's not something that's retroactive. Like you have to, and it's not automatically done. I wish it was automatically done, that you were automatically screened for it. And if you were eligible, they helped you out, but they don't. So you do have to, as an agent, as long as you have that information and you're able to pass them and give them this information, then you're doing better than probably 80% of the agents in America do. So that's great.
So, Kathy asked, and I think you would know since you help, is what supporting documents are required? Like what's an example of what they would have to provide?
Okay, so supporting documents. So normally, if they're working a W-2 job, they're going to ask for check stubs. Obviously, if it's somebody who is self-employed, it's kind of going to be the same documentation that we would use for ACA. So they're going to ask for tax returns. You may have to show them, proof of your income. Like here we're in April. If I had somebody that I was helping apply now, because they're not going by your past income, and it's not really what your projected income is, but it's what your current income is. Like with Medicaid, they go by that current month that you're in. What are you getting this month? It's kind of like that. So if I was helping somebody now that was either self-employed or W-2, I would ask for the last 3 months of their income, so proof of that income. And then in the patient assistance programs, you do have to be a U.S. citizen. uh, I don't really run across that as a problem, to be honest, very often, because most of my immigrants in the area, I will help them other ways. They are not really fond of applying for these programs, so um, it's usually not an issue. But you can, if you're asked, you can present like their visa, a green card, whatever you need. But really, it's just showing something that's showing your current income and your current address where you live, because some of these are required, to live in a certain county. If you get services at St. Vincent's in Chilton County here in Clanton, then you need to live within Chilton one or one of the surrounding area or counties.
Jill
So
said, do you know if this helps with Medicare as well? I see a tab for Medicare resources. She'll dig into it later, but if you had any examples of Medicare using.
yes, so Medicare, I do actually. So one of the things with Medicare, as far as the cost with patient assistance programs, yes, they do help too. And when it's somebody like that, I don't have enough Medicare claims experience and that kind of stuff. I'm kind of new. Like this is only my second year really doing Medicare, but yes, there is help for Medicare beneficiaries. They are different than it's going to be for someone who's not insured or someone who has ACA. So with those, I will actually have them call. I will definitely have them call the patient advocate org and talk to them, or the patient advocate foundation, and speak to them. They will get them in touch with somebody who specifically helps Medicare people. But the part that I deal with mostly with Medicaid or Medicare is the prescription costs. Because what happened, so one of the ones that I take, so I happen to personally take Trelegy, electric Trelegy. It's a asthma medication and for COPD. So a lot of my Medicare patients are on this, and it's kind of expensive. It can be like $450 every 3 months, which adds up for them. But the problem is sometimes they'll say, hey, I've got a manufacturer's drug coupon. I took it to the pharmacy. They said they can't take it because I have Medicare. That's true. That is true. Because of anti-kickback laws, yeah, then it is set up a certain way. There are foundations that are set up specifically by the actual drug company. So like GlaxoSmithKline has Trelegy. So there are rules, and it's based on income too, but they can get help. They just can't give the pharmacy the coupon. They're going to have to call. They can use patientadvocate.org and go on there. There's a prescription, you can search a database, and it'll tell you which drug company it searches database, which drug it is, what you need help with. But then it will give you an application, and I help my people fill out their applications. There is proof of income, usually Social Security with my people, so I'll send them a copy of that. But there are certain rules too, like with Trelegy. You have to pay with my Medicare. You have to pay $600 in for your household. You have to have paid out $600 in out of pocket cost for the people in your household for medical expenses. So once you hit the rest of their prescriptions have hit $600, after that we apply for a Trelegy form, and it's a zero cost for the entire rest of the year. And it's a 1-year thing, and they apply every year and recertify. But I mean, there's programs out there for a lot of those. I
And you
of
found
course
this on
everybody.
the patientadvocate.org.
Yes, you can get
Okay.
your patientadvocate.org. This one is, I'm going to show this real quick just to show you what it looks like on their actual, because you can go to the drug site. If you know which prescription it is, you can look it up, and you just go to the actual, to the drug site. So this is for the manufacturer. This is GSK's. On here, it will ask you whether you're wanting help with a vaccine or medicine. You just put it in. It's really easy. It's very easy to use. Here's a Noroliptis, or just an example. It will actually take you to, let's see the results. Save that. Sorry about that. It'll ask you where you live. They are different. And one thing I want to say about the patient financial programs, even though they are required by by federal law to have a patient assistance program, they actually vary. There is not one set, there's not one set thing that they have to help with. There's not a certain amount they have to help with. There's not a certain income they have to help with. They differ between states. Different states have different laws, and they also differ between, they'll differ between even hospitals or the center where they're at. So that you do have to make sure that, sorry about that.
Might have to hit
You do
save.
have to make sure you check their actual, you check their actual, you check the actual hospital or provider that's right there, and to make sure that you're looking at the requirements for that hospital since there's not set ones. But anyway, so this is for this specific medicine. So there's trial offers. I put in Medicare. And so you just go through and kind of, you follow what it says. You can see eligibility, um, who is eligible for it, what the programs are. There's a place that you can apply online, or you can print a prescription, if you have Medicare or ACA clients too. If it's just a manufacturer's discount coupon, you can sign up online. If it's something that needs to be done through a foundation, you can do it on there too. But these sites are specifically set up to be easy to use, because the people that are using them are usually not, they're not medical providers, and they are not usually insurance agents, because it's usually someone who's an individual going on there, to do it by themselves, and it can get confusing. So, it's nice that's the reason I'm here, for people to kind of walk them through the process. And then once you've done a couple for your clients, it's really easy. I mean, it doesn't take 5 minutes to help them apply for them.
And Ryan asked, is this nationwide? And that is yes, this is nationwide. So if you go onto that link that I put in the chat, and it's patient advocate, all spelled out.org, you can find the stuff for your state. I did put a link in there as well, for the Aging and Disability Resource Center, which is specifically for people on disability and Medicare. Again, that's a community, that's county, and it's nationwide. So I just put that link on there. We send a lot of people to our Aging and Disability Resource Center when they're either getting disability, or maybe they are disabled, but they've been having trouble applying. That's what that can help with. And it can help with some other programs. Especially people who are right on the cusp of Medicaid and they're eligible for Medicare, but they need to do spend downs. That's the Aging and Disability Resource Center.
Yeah, they're great. I work with them. I love, so the elderly and disabled waiver, we have the Medicare savings programs, LIS. If you do Medicare, you can sit there, drug low income subsidy. That's a federal level. Everything else is state level. But if you're not sure what to do, and you just have an elderly person or disabled person that, or say that they are on ACA and they are almost at that 24-month mark, and they're going to be moving to Medicare, and you're not sure, how that's going to affect them, because they're going to then having to start paying for part A or in B and a supplement, then that's the place to send them, because Medicare savings programs are, like I said, are state-based. And essentially you can help somebody go from having to pay, for a supplement, a couple $100, and then you're talking about so $400 or $500 a month, to not only paying $0 a month, getting their premium back, but also zero cost for their drugs. So, trying to tell people, just think about how you want your parents treated. How do you want, somebody to take care of your mom? Do that.
And I know a lot of you talk about networking and marketing and who should I go to. If you can get in on the Aging and Disability Resource Center in with those people, they are a great resource. So, call them up and say, I'm an agent in the area. Can I come out and find out what you do? And if you're genuinely interested in what they do, believe me, they will send people to you, because they're looking for agents that they think are ethical and are not selling a product. If you're an agent for one particular carrier as a Medicare, they don't even necessarily want to send people to you, because they know that there's options out there. So if you're a broker and you can sell lots of options, whether it's Medicare or ACA, the Aging and Disability Resource Center is a great referral, because I want to send people to you. How can you help clients? And if you listen to what they're saying and then start using them as a resource, they will also use you as a resource, because they're not allowed. They're not agents. They can't sign people up for those plans. They can give advice. They can kind of direct them, but they can't sign them up for an Advantage Plan or supplement or the marketplace. So, and then Erin, the other website you brought up when we were talking was communityresourcefinder.org, all spelled out, communityresourcefinder.org. And what's
Yes, so that is, let me share this one on here too. Yes, so that's Community Resource Finder.
These resources are, somebody had asked one, let's say somebody says they think they're going to make 50,000, right? They don't have a job and they're going to make 50. So they're like, no, I can afford to pay that $50,000 premium, right? And then they actually only end up making 14,000 or 16 because they didn't get a job and maybe they got injured and they were never in the CSR that they should have been in that cost sharing of the deductibles. These are the resources you can help because you cannot backdate cost sharing reduction. So you can't go back into the marketplace, say, hey, I know I said 50, but I really only made 17. Can I get in that deductible? No, here's the resources now that can kind of help them pay for what they should have been paying if they had only put 16,000 instead of the 50.
Right. So this Community Resource Finder, this is one that's specifically geared. It partners with AARP, and it's specifically geared toward Alzheimer's, the Alzheimer's Association. And this one is a database. It's just an example. So the reason I want to do this is it's just an example of a database, in one of the databases that are accessible through patientadvocate.org. So if you go to patientadvocate.org first, you can put in, if there's a certain medical condition they're needing help with. These are the kind of resources that you're going to find that are on there. And sometimes it will link you from patientadvocate.org. It will it will direct you to a resource like this. And like on this one, you can go through and there's a search function that's on here. Second. In this one, you can look through, there's care at home options, there's housing options. This one helps with medical services. It helps you find them, and then it will not only help you find them, but it also helps you connect you with the resources to help pay for them. So that was one of the reasons I wanted to go with communityresourcefinder.org. .org. Stop sharing that one. Okay. The other thing, as far as like community resources that I had said something to you about is, so every place has a community action. Every state, all areas, they've got community actions, and those are going to be the places that will help with food banks. A lot of them have food banks at them. They will connect you with food banks. They help with LIHEAP, which is the energy assistance that helps people pay their power bills. They also, at community actions, will help pay emergency medical bills. They can usually step in and pay like a one-time dental bill for emergencies. They can do, like, if somebody has prescriptions that are already prescribed and it's going to cost them $25 they don't have, community action can help pay for a one-time prescription. With those places, a lot of times with community actions, you will have something to do. There will be somebody there that will help or know about the patient financial assistance programs too, that will be able to direct your client to them. But those are the greatest places to start. And so one of the other great thing is they usually have what's called a community resource map. And what that is something that I learned how to do when I was
I'm just showing
at Troy in school.
action.
So oh yeah, no, you're fine.
Google,
so
action, and
community actions. Yeah,
so you can.
Yeah, if you just Google community action, you'll fit a bunch of them. Yeah, and they usually work within zip codes. Like you have to live in this zip code, this zip code, or this one to use this community action, and which it'll place you in the right one. But they're also, if you Google community resource map, which is what I did when I was going to school at Troy. Basically, what would pop up for us is we were able to find maps that basically put on one map for you all the community actions, all of the elderly and disabled care, the centers for aging that are on there, food banks, places that if there is like a charity that helps people apply, SHIP. So SHIP is the state health insurance program. So basically it's a navigator system, people who are a nonprofit that help people navigate Medicare, but you can get those to pop up. But sometimes your health department in your county will have a resource map that they can give you that have all those listed out on there. Right. And of course the health department is a great place to start too. If you're needing If somebody is having a medical problem and they are needing to have a surgery done and get in touch, the state health department is a great place to go, because the other thing with the patient assistance programs is you can't just walk into any doctor's office and say, I need to have a surgery done. I need you to hook me up with the patient assistance program. It doesn't work that way. There has to be a scheduled procedure, or it has to go through a hospital, but your doctor's office will be able to direct you or your client to that.
So there's a question. I don't know that you've done this, but Rosalind was wondering, have you created a one-page summary of all the resources that are at the patientadvocate.org?
I have not. I'm sorry. I'm having problems. Like, I've got a rolly cart and this is going well. Anyway, I have not, but I think that I'm going to. I will. So if you want a copy of it, then I'd be happy to, or I'll give it to you and you can email it.
Yeah, send it to me. I'll send it out. If anybody else creates it, if you're one of those people, you got time and you're good at that. I mean, I'm like, that's a great idea. I have no time. But yeah, something that we can hand out as a brochure or just a pamphlet to our clients, right? Saying, here, this is, go find this information. So
yeah, absolutely.
So we're getting close to the end. Any last minute questions that you have for anyone? I just thought this would be a great resource we're always trying to give resources. My receptionist is like the queen of finding the manufacturer's coupon like that. And we've had people call that they're not clients. They work at some other place, but they've heard, and they'll call and she'll find them that manufacturer coupon and stuff. And it's nice to know there's Medicaid or Medicare options. So I know a lot of you are like me. We're just trying to help people. So any questions for anyone or for me?
The last thing I want to say is that I am not a professional dude. I am a formally trained community health worker. Yes, but I am not a professional. I don't do that. I don't get paid to do this. This is just stuff that I've learned on my own through the years. And I want people to understand that, like, this is something that you can do. If you're an ACA agent, you can help people apply for these programs. You don't have to have some kind of certification or license or this and that. This is just everyday stuff that you can do. But like I said, I am not eloquent with words. I am not, I'm a little rough around the edges. I don't really know what to say in a interview like this, but I want to genuinely help people. And if you have that same kind of desire, there are always ways to do so. So just don't feel like you need to be a formally professional person doing this to help. Just try. People will be happy if you just try.
And I'm telling you, when you help people, that is one of the best referrals you're going to get. I'm helping you because it's the right thing to do. You're not my agent or my client. I'm not your agent because I'm sending you somewhere, but they're going to tell people that you cared. And you're going to find out their sister, is going to call you, their brother, their coworker. This is one of the best ways to build the referral partner. And you're not going to lose those referrals. Every marketing person in the world since the beginning says the best way to build your business is referrals, right? I'm not going to lose a lot of clients because they come to me, they trust me. They're not looking online and filling out those things. So if you're helping people, you'll get known and people will start coming to you and you're going to help them get insurance and become, you're going to get those clients.
Yes, I am.
And there is, and I forgot to mention this last week and at the beginning. So I know some people are at Medicarian right now. There is that other conference that I have mentioned before at North American. They're having their one in Texas. They're having a bit of a flash sale. So if you go on there, and I'm going to go to the website and show you at na-insurance.com, that company is going to do a flash sale. So you can jump in now. And if you buy, so here it's na-insurance.com, go to the conference and it's in July. It's very much about the tech stuff. Come down here and get tech. It's July 15th through the 16th in Frisco, Texas. I always want to say San Francisco, but it's here, July 15th and 16th in Frisco. Get your tickets. They're pretty cheap. They're either $99 or $299, but they're having a flash sale. So they're doing them much cheaper. And I will give you the code for jumping in on that. I'm going to be there. Lots of other people are going to be there. I'm actually really excited about it because every year they do a little bit more. So this one's going to be a lot about automations and AI, things like that. So if you go there and then just buy the $99 one, buy the cheap one, and then use the promo code UPGRADE. So all one word, all capitals, upgrade. That's just going to move you to the VIP. So you get to get into the VIP for the cost of a regular one. And the VIP is fun. There's extra dinners. We're meeting at where the Cowboys practice. Right up here is a club. We're all going to go up there and have get to be in an exclusive club. I mean, if you ever wanted to see what the rich people go to, hey, this is your chance, because you get to see their club. It's still a club. It's just the chairs are nicer. The drinks are fancier. So you can stay at the Omni. That's where it's going to be. Or really close by is the ACA Marriott and the Hilton, and those are significantly cheaper, and they're like a block. So it's not like, oh, I'm gonna have to Uber it. So if anybody wants to go, just click get tickets at na-insurance.com. I would love to see you all there. It's 2 days of just lots of input, and those who have been there before know it's more intimate. It's not the Medicarian. It's not thousands of people. It's usually around 100, 110. So you actually get to meet people. All right. Got some great ones that people are asking. I saw Kathy, you said needy, NEDDY meds.org.
Yes.
Great resources.
Yes.
And Jill says, do you know of any programs to help with expensive meds for the people that are over the threshold of poverty? Most of the manufacturer meds, when they do an income, it's 400% or below. So
yes, it's usually about 400%, Chris. It's a lot higher than people would think that it would be. 400%. There is one more thing that I wanted to mention that I personally have experience with. I believe it's on patientadvocate.org is where we found it. There is a there's a grant program that you can find on there too. I'll see if I can find that link too. There are a lot of grants out there for things that you wouldn't think. So I have a sister who's in Alaska right now who had a knee surgery. She got an infection in it. She had a sepsis infection. And there's actually a grant that we applied for called the New or Begin Again grant. It's $1,000 grant that they, give out on this. You just fill out the application. They check your diagnosis with your doctor. And it's $1,000 that she was granted to cover she had to fly from Kodiak, Alaska to Anchorage for surgery and treatment, but she just got her check in the mail. It's really, they're easy. They're on there. There's some for COVID that I think are still on there, for sepsis, several different things, dialysis, acute, all kinds of things. But if you call, you can get on there and explore. If you go onto the patientadvocate.org, you just put explore resources and click on that button, and it'll bring them up for you too. But I'll include those on a summary for you.
All right. Thank you so much, Erin. I really appreciate that you took the time out.
I appreciate you. I think I'm boring, but I appreciate you a lot.
And I know your life's been a little crazy, and I really appreciate you coming on. And I appreciate everybody who jumped in and was watching as usual. I will send this out by YouTube or by email, and then it'll be on the YouTube channel. I will put the links in there on both in the email, and it'll also be on the YouTube chat. So thank you very much, everybody. Have a wonderful Thursday. And I'll see you next week.
Bye. Thank you.